Did you know that sperm health is really important and that you can actually check your sperm health early on so that you could potentially avoid problems? You could also do things to prepare your sperm for the time that you're ready to get pregnant. There's so many things to understand, and most importantly, that there's no shame involved in male infertility. And today I'm going to talk about all these things and more with Dr. Justin Houman, who's going to give us a lot of information on male infertility and what you should know about sperm health. Welcome to Building Your Family. This is a podcast about fertility treatment, donor conception, surrogacy, and all the ways the modern family is built. My name is Lisa Houman. I'm your host. I'm a therapist, a researcher, an author, and I'm so glad today to introduce you to somebody who's going to give us a lot of terrific information on male infertility. That is Dr. Justin Houman. So he is a board-certified urologist, and he has done so many things. He specializes in men's sexual and reproductive health, but he's also going to share with us not only the things that he does for his patients, but that he does for the entire community, because reproductive medicine is so important to understand with regard to the man as well as the woman. And very often we look at women's issues. So he's going to tell us what male infertility is about and how we can understand it, because very often, as you've seen in this podcast, we don't always know what to look for. So welcome, Dr. Houman. Thank you so much for joining us.
Thank you. Thank you for having me. Excited for this.
It's my pleasure. And I think it would be so helpful to start to talk to the audience a little bit about male infertility. So often we talk about fertility treatment and women's issues and the aging of the eggs and what it looks like in the lab, but we don't talk a lot about male factor infertility. So could you give us a little bit of information about how to think about it, how people know that they have male factor infertility, and what to think about when they start to build their family?
Yeah, absolutely. So male infertility is somewhat of a taboo subject for a lot of guys. No guy wants to hear that they're having fertility issues. It's one of those things of men are supposed to be virile, they're supposed to be strong, they're supposed to have, hypermasculine, no issues with reproduction. But the thing to remember is amongst couples who are experiencing infertility, half the time it's the male's fault, it's male factor infertility. And it's due to a number of reasons, and we'll dive into that. But some of them are medical, where they're hormonal abnormalities. Some of them are lifestyle related, and some of them are just anatomical issues that require some kind of microsurgical intervention. One thing I would say is male factor infertility is quite common and relatively easy to treat when we're able to diagnose it early on.
And how does someone know that they have male infertility?
Really, the only way of knowing is by doing a semen analysis. A lot of times couples are trying for 3, 6, 12, sometimes 12 months, sometimes a couple years before they even come in to do a semen analysis. Once they do that semen analysis, they see that they're having infertility issues, or their semen counts are low, and hence the reason the male is responsible for some of those issues. There's no signs or symptoms associated with male infertility. It's not like you feel that you have low sperm counts. That's the thing to remember. There's no signs or symptoms related to male factor infertility. So if you do think that you are having infertility issues, the best thing to do is just do a semen analysis. And nowadays, you could do these tests at home to get a gauge of where you are, where you stand. And that really helps at least screen the male out in terms of trying to figure out what's going on for a couple's fertility journey.
So do you recommend that people, before they start their family building journey, when they're thinking about, okay, it's now we want to start thinking about having a baby, that they get a workup right away, or should they be trying at home for a little bit?
It's a great question. There's no real right answer associated with this, but I would say if you've had fertility issues in the past, across the board, I would say the earlier the better. But generally speaking, if a couple's had issues for trying to conceive for about 3 to 6 months, that's when I generally recommend both partners should be checked, not just the male partner, both partners, where the male will go, again, just check a semen analysis. That's the easiest screening test to see where you stand. And if there are any issues, seeing a reproductive urologist like myself will do a few other tests just to make sure everything is okay. But I would say, again, about no more than 3 to 6 months as you're trying to conceive, if you are having issues, it's time to be seen by a doctor.
So we're talking now about starting at home to try to get pregnant. And that's with heterosexual couples, I think that probably with lesbian couples, it would be really important who are using a known donor, right? Because those people don't know that their donor might have infertility issues and they're trying to get pregnant either with IUI or at home with a midwife or on their own. And they wouldn't know that maybe their donor has some issues, right?
Exactly right. Exactly right. So to your point, getting that male donor evaluated, making sure that their sperm counts look good. And if there are any issues with their sperm counts, making sure that they see a reproductive urologist. Because a lot of times, even when a male donor submits his sperm sample, his semen sample, although the counts may look good, sometimes they have there's abnormalities with the DNA fragmentation of the sperm or the quality of the sperm, and
Mm.
that may not take. Obviously, this is a small step, very small subset of patients. Usually, those issues are able to be overcome through assisted reproductive technologies, IUI, IVF, ICSI, those types of things. But that being said, it's important for the male donor to be evaluated as well, just to make sure that when the time comes to try to put the egg and the sperm together, you are able to get a good, healthy embryo because both the sperm and the egg are healthy.
So important. And particularly because if a woman is starting to try to get pregnant when she's in her 30s, right? And then she continues for several months, whether it's a woman in a heterosexual relationship or a lesbian couple, their eggs are getting older, right? So the longer they wait, the more potential for issue, right? If they find out about the sperm early on, they're also helping themselves because they're saving their own reproductive clock, right? They're helping themselves.
Precisely. Time is very valuable. The older we get, obviously, the more valuable it gets. And I'll say this a couple times: the earlier you get evaluated, the earlier you address these issues, the better off you will be. Because I mean, I could just tell you from a male standpoint, it takes about 3 to 4 months to notice any benefit from the changes you made, whether it's lifestyle, surgery, medicine. At least 3 to 4 months, sometimes as much as sometimes 6 months. So the earlier, the better.
Yeah, that's really important. So I want to address that, but first I wanted to just kind of go back to what we started to talk about with reproductive health and aging. There's a lot of misunderstanding out there. People do feel so worried. Of course, there's so much emphasis on your eggs and ovarian decline and all of that. And so there understandably is some concern about women getting into their 30s. When do we have to worry about the male factor infertility or men having declining sperm quality?
Yeah, a great question. Generally speaking, it's starting at the age of 30. We start to see a slow
Oh,
decline, and that persists into our 60s, 70s, 80s. I think Robert De Niro and Al Pacino just had children in
yes,
their 70s and 80s,
yes.
and healthy, what appears to be healthy children. So the thing to remember is there's a decline. It's a slow decline for men, but a decline nonetheless. The decline starts in your 30s, but I would say starting after the age of 40 or 45 is when we start to see some of those genetic issues. DNA of the sperm isn't as great, it's not as high quality. So that's when you start to get some of the genetic issues associated with male factor, or age related, advanced paternal age, 40 or 50 years old.
So, what sorts of issues can people be concerned about?
There's a number of them. There's no hard and fast rule. Things like Asperger's along that spectrum. That's really one of the more common ones. But the other ones, there's nothing clearly to state that this particular genetic issue is associated with male factor infertility. There's a variety of them. There's not a few that you could list that are just associated with the male factor.
So it's really, I guess, that our potential for these problems increase, not necessarily there's this hard and fast rules, what you're saying.
100%, 100%. And then you have to remember it takes two to tango. So it also depends on the age of the female partner, what the quality of her eggs are. Sometimes great quality eggs could overcome some of the issues from the male standpoint. Sometimes they can't.
Hmm. When we look at an issue like that and people are maybe thinking, well, my partner is already 50 something years old or older than that. Do I have to be worried?
First off, you want to do a genetic screening. If you are worried, you could do a genetic screening just to see what you're a carrier for what. Like, what are you a carrier for with the male or the female partner? That could lay out some of the baseline genetic issues that are related to no matter what your age is. Those are the things that you, as a couple, you guys are at risk for. Because some of these things aren't even age related. They're just because of your sperm and her eggs. and your DNA. So that's one.
Mm-hmm.
Number two is to what extent is this going to be an issue? A lot of times you have to remember the poor quality sperm aren't going to make it to the egg, or even if they make it to the egg, they're not going to penetrate and create a healthy embryo. If they do create an embryo, a lot of times that because that sperm is so unhealthy, the embryo won't it won't necessarily become an embryo, right? It'll die off before it becomes anything viable. So evolution helps protect against a lot of these issues, not all of them. And then when you ask what can they do, can you do IVF and ICSI and trying to find the best sperm and the healthiest quality egg and put them together? Yeah, you could do that, but of course that costs a lot of money, and it comes at you're from a female standpoint, you're getting trigger shots. The hormone changes can be quite morbid, can create a lot of discomfort for them from a hormonal standpoint. So it does come at a cost, not just from financial, but also from a physical standpoint. But the thing to remember is most of the time, healthy sperm will make it to the egg and everything should be fine.
So there is a potential for healthy sperm to make it. And if not, even though there are options that are not always appealing because they may not be comfortable or inexpensive, there are some solutions, particularly for sperm.
Absolutely. Absolutely. And you have to remember, a guy typically ejaculates tens of millions, sometimes hundreds of millions of sperm with each ejaculate. And all you need is one healthy one, right? One of those has to be healthy. So again, evolution has kind of figured this out in many ways. Like that healthy one, majority of the time will get there. If the unhealthy one gets there first, it's not going to become a healthy embryo.
Right, right. Well, that's very helpful. And then what about sperm health? Like, how can people think about taking care of their sperm, taking care of their bodies? They're thinking, okay, I'm going to either be a donor or I'm going to marry somebody, and I want to make sure that in 6 months from now or a year from now, my sperm is healthy enough that I won't have to worry about these things, or I could reduce the risk a little bit. What can people do?
Yeah, so it's pretty simple. It's what's good for your heart, what's good for your overall health is good for your sperm health. And it's good, the reason I like to simplify this is because if you're doing the things that are good for your sperm health, you're doing things that are good for your heart. And ultimately, once you become a father, you're going to be a healthier father. So what are those things? It's four simple things. Number one, a well-balanced diet. When I say that, lean proteins, complex carbohydrates, and healthy fats. Do that as much as you can. Obviously, no one's perfect when it comes to that, but a healthy diet is probably the best thing you could do, not for your overall health, but also your sperm health. Exercise. I always tell patients, try to get 2 to 3 days of weightlifting, 1 to 2 days of cardio a week. So about 4 days of exercise, 4 to 5 days. That helps a lot. Number three, sleep, which is probably the hardest one, at least 7 hours of sleep. And the reason why sleep is so important, it's good for hormonal health. We know that healthy sperm need good to intratesticular testosterone levels. So poor sleep significantly decreases, especially if it's long term. You're getting poor sleep numerous nights in a row. It significantly impacts our testosterone levels.
Really?
Yeah,
Wow.
Definitely. We've done a lot of studies on this. So sleep is quite important. At least 7, ideally 8 hours of sleep a night if you can. And then number four, it's stress. And again, I'm not here to say that I've figured this out. Stress is incredibly hard to manage. But by lowering your stress levels, the same precursor hormone that goes towards the testosterone production, it also goes to the stress hormone cortisol. So if you're burning things towards cortisol, less of that precursor hormone is going to testosterone production. As I mentioned, low intratesticular testosterone levels is not good for sperm maturation and sperm health. So those four things, if you're able to do those, you don't have to necessarily take tons of supplements. Supplements can help, right? But they're not moving the needle significantly. They can only help. They move the needle in the positive direction. But those four things, if you want to simplify your life, are good for your sperm health, good for your heart health, good for overall health.
Great advice. And as you said, I think it's important for people to remember, because people always walk away thinking they have to be perfect. You don't have to be perfect. You just have, don't worry about the chocolate chip cookies on the weekend. Don't worry about, the night that you worked late. But generally speaking, try your best to live a healthy life.
Exactly. Just be mindful of it. The more mindful you are, you're bound to make better decisions.
And what about the don't? Like, what would you put in the, so we talked about the do category. What would you put in the don't category?
Yeah, great point. A couple things. Anything that increases testicular temperatures. So saunas, steam rooms, jacuzzis, all of those things, try to stay away from those. Hot yoga is something that's quite popular. Stay away from those because the testicles are exposed to elevated temperatures for long periods of time. the DNA of the sperm, the DNA integrity could be compromised. So stay away from those. Obviously, smoking, drink, any cigarette smoking is obviously very bad.
Vaping.
Vaping along those lines, 100% vaping, no, not good at all. Alcohol, binge drinking is what really impacts it negatively. Having one or two
Really?
drinks socially. Yeah, it's when you're having the 5, 6 drinks a night that could really significantly impact your sperm health, especially if you're doing this on a weekly basis. Marijuana, I would try to stay away from it. There's some data to suggest that marijuana is an aphrodisiac for some men, so they're engaging in more frequent intercourse, and as a result of that, chances of conception are higher. So marijuana, I would lean towards saying no, but tobacco, 100% no. And then a couple things I tell guys is put your cell phone in your back pocket. We don't have a lot of good data on cell phones causing sperm damage, or at least in vivo data. But there is some like lab studies that show that it can negatively impact sperm quality, sperm motility, morphology. So I always tell guys, put it in your back pocket. And then lastly, get out there and just, get some sun.
Vitamin D.
Yeah, don't stay indoors. Get some sun. Get 20 to 30 minutes of sun every day. Vitamin D, good for your hormone levels, good for your immune system, good for overall health. So don't just stay indoors.
Don't just stay indoors. That's great. And then what about these other things that people are worried about? So, for example, we had Colton Underwood on talking about taking hormones, and he was, he felt like they were positive for him in terms of his mood and, obviously his physique, but, in terms of his mood, they were helpful to him. And he didn't realize that that would impact his sperm quality.
It's a great point. I can't tell you how many times in a given week, someone comes in, a young, healthy guy comes in. He's like, I have no sperm on my semen analysis. And I ask them, are you taking testosterone? They're like, yeah, I've been on it for a few years. No one ever told me that I'm not supposed to take testosterone, that it could impact my fertility. So we know that testosterone replacement therapy shuts down your testicles. So you're not producing natural testosterone, number one. And number two, you're not producing sperm. Now, this could, majority, almost 90% of the time, we're able to reverse this and get you back into producing normal testosterone levels, natural testosterone levels, and then rebuilding your natural sperm production. But yeah, that's the one thing, to be aware of. If you're going to start testosterone replacement therapy, I generally tell guys, look, I have a lot of guys who come in for TRT in my clinic, but I always tell them, bank your sperm first. That's one thing you can do. Hold on to that sperm so you could use that sperm down the road if you want to. Number one, or number two, there's a lot of other ways in which we're able to basically tell the testicles to produce more testosterone. So if you're experiencing low testosterone symptoms, you don't need testosterone as a young guy. Majority of the time, there's medications that we can tell your testicle produce more T, and you'll feel a lot better without compromising your future fertility health.
Oh, that's great. It's great to know there's substitutes.
Definitely. There's tons. I mean, any guy in his 20s, 30s, or 40s should not be on TRT. I mean, some guys should, obviously, after you've had children. But if you haven't had children, there's ways in which we could boost your testosterone levels, make you feel good without compromising your fertility. I guarantee it.
That's amazing.
Yeah.
That's wonderful. Are there other reasons why people should bank their sperm?
There's no harm in it, right? So let's say you're a guy in his late 30s, still single, no one, there's no prospects. Can you bank your sperm? Absolutely, right? Absolutely. Can you use that sperm? Well, does that mean that you're going to be using that sperm down the road? No, because as I mentioned, there's a slow decline when it comes to sperm health. It's not once we hit menopause, the counts go down significantly. Once we hit our 40s, it's not related in that way from a male standpoint. Essentially, I would sum it up to be, there's no harm in doing it. So if it's something that you want to do, by all means. But the scenario I gave of a guy in his late 30s, that's the only time I would say, hey, maybe it's worth doing if you are interested in having kids down the road.
And then I guess also for people who are transitioning, they may want to bank their sperm too.
Absolutely, 100%. That's a perfect example, right? When you're trying to transition, without question, before you get on the hormones, bank as much sperm as possible. And it's becoming so much easier to bank these days. So if you are having it, there's tons of online companies that actually do it for you. But yes, when you are transitioning, that's a great point.
As we're talking about banking sperm and keeping sperm, I think there's this misunderstanding about how sperm is produced. And maybe you can explain to the audience a little bit, because sometimes people think, well, if I'm in a heterosexual relationship and I don't have sex for a week, and then I have sex with my wife or my partner, I'm more likely to have good sperm because I'm kind of saving it up.
Yeah, yeah, I've heard that one
Right?
too. That's why I'm
Yeah.
laughing. The question is how much are you storing? And everyone's a little different. Should you wait 2 weeks? Probably not. Should you wait? Generally, I say about 3 to 7 days. Because the thing you have to remember, the longer it stays, the longer it's stored, it slowly decays over time. The quality starts to decay over time. So it's kind of a parabola. There's a sweet spot that you hit after a few days. And again, I'm saying within about 3 to 7 days. After that, the quality of the sperm can get starts to decay. And remember, mind you, I'm saying this across the general population, right? Are some guys different? Absolutely. But I try to tell guys during that ovulation window, try to engage in some form of ejaculation with your partner at least every 2 to 3 days. That gives you enough time to build some production,
Mm-hmm.
but and also creates enough of a time period in between ejaculations that hopefully some of the sperm make it to the egg.
Right. So people should know the sperm's actually going to deteriorate a little bit, right? Because it's not just going from the sperm source out, it's going into like a container first, right?
Yeah, it sits in the epididymis where
Mm-hmm.
it's supposed to mature. But again, I mean, the thing is, it sits there for long periods of time, and that's why we talk about inevitably your testicles are going to be exposed to some elevated temperatures throughout the course of the day. When you're sitting for long periods of time between your legs, your scrotum is the thermostat, right? So it relaxes and contracts relative to where the testicles want to live in that narrow temperature range. But inevitably, they're going to be exposed to elevated temperatures, and during those periods is when that sperm starts to get impacted negatively. So the more you clear the pipes, if you will, for just because I have no better way of saying it,
Mm-hmm.
just do it more regularly around that ovulation window.
Does that mean that people should try to stand up more often and not sit down? And
Yeah, definitely, right. So sitting down for a long period, desk. A lot of us have desk jobs now where we're sitting down for 8 hours a day. That's why we have all these different
stand up
these health
desk? And
apps, Apple Watch, Oura Ring, they tell you every hour stand up for 5-10 minutes. It's really obviously to get the blood flowing, get things moving, get some sunlight, if you will. But more importantly, one of the benefits of that is it doesn't, your testicles get a chance to breathe.
and what about people say you should put a laptop on your lap because that's not that heat is no good either. Is that true?
Yeah, for long periods of time. So as I was saying, anything that increases testicular temperatures for long, for periods of time of more than 20-30 minutes, it's going to impact your sperm quality. So try to avoid that as well. That's one of the other don'ts that I forgot to mention. Absolutely.
And that's kind of in the heat category anyway. It's not the
Exactly.
radiation, right? It's kind of the heat from the laptop.
Exactly. It's the warmth. Put a pillow there between your lap and your laptop. Just put a pillow in between, and that can
Mm-hmm.
help avoid some of that elevated temperature.
Mm-hmm. That's great information. So I'm wondering, is there anything else, Dr. Houman, that we're forgetting? Because I feel like we're covering a lot of good subjects today, and you're really helping our audience understand some of these things that are so important to understand. Do you feel like there's anything that we're leaving out?
I guess the one thing I would say is I want to normalize. Part of what I want to do is normalize the conversation about male infertility. If I told you how common, I mean, obviously, look, I see this on a day in and day out basis. There's tons of couples. There's a lot of couples who are struggling with fertility, and it's not always the male. It's not always only the female, right? But half the time, it is the male factor. And the earlier you get evaluated for this, the earlier you try to get past the taboos, the stigmas associated with it, the better off you will be. You'll be happier as a result of continuing along your fertility journey. If you think that there's issues associated with it, I'm the only guy who is experiencing this. I promise you, you're not even close. There's tons of guys who are experiencing this. Just get evaluated early.
And as you're saying, there's really nothing to be afraid of because so many of these problems can be remediated easy. It's fairly easy, right? Like there are lots of things you can do.
Yeah, lifestyle changes. Even we may have to do some hormone modulation. In some cases, there's an anatomical issue that we have to fix surgically. But most patients we're able to move the needle enough where we can get them back to normal sperm levels and then achieve their reproductive goals as a result of it.
That's great. That's great. And as you said, it's going to take some time for this, even after that, right? After you've already given the patient the medication or perform the surgery, it's still going to take a few months. So people really need to think ahead of time.
Exactly. That's the point here, because a lot of times, especially here in Los Angeles, it's a lot of older couples
Mm-hmm.
who are getting together, and when your partner, she's 37, 38. Obviously that's young in the realm of life, but for fertility, we're burning daylight, precious daylight. Because I said, it takes 3, 4, sometimes 6 months to notice the sperm changes. So it all comes back to that point of early intervention is the best. So early diagnosis, earlier seeing your doctor will only benefit you.
That's wonderful advice. Well, I really appreciate all of this advice, and I hope that people will listen and come to see Dr. Houman, because this is really important to do. You really need to think about it. And, I think it's very hard when you're certainly a new couple to think about what could be wrong, but even for lesbian couples, right? You want to be happy, and all you're thinking about is, well, we don't have the sperm, so we're going to get the sperm and we'll be fine. And sometimes that's not the whole story, and you want to make sure that everything goes well.
Exactly right. Exactly right. There's tons of variables involved. All we can do is control how we address those variables.
Yes. Well, thank you so much for your time. And tell me, how can we reach you, and how could the audience reach you?
Yeah, so you could look me up across on the internet. Justin Houman, MD, Houman is my last name. I'm on all the social media sites. I have a website, and I'm based here in Los Angeles, right here in Beverly Hills. So if I could be of any help, whether it's for in-person consultation, telehealth, or just questions through the social media platforms, reach out. I'm happy to help out in any way.
Oh, terrific. That's great. Well, thank you so much. And Dr. Houman does have a lot of really terrific content on his social media page. So if you want to take a look there, he's got lots of great videos. So I encourage everybody out there to look at them.
Thank you.
You're welcome. And thank you all for being here. I really appreciate your time, and I hope that you got something out of it. This is really valuable information, and it's so important to take care of yourself, take care of your reproductive life. You will be happy that you did. So thank you for joining us, and please subscribe, because that's how we keep going. And I will see you next week. Hi, it's Lisa Houman. I hope that you enjoyed that video, and I hope it helped you. And if it did, please give us a thumbs up and subscribe, because that's how we keep going. It's really important to us. And if you liked it, you might like this one.